Hi everyone, I'm Steve Main. As you know, or maybe you don't know, I'm owner of multiple health clubs. Here with Dr. Nario of Biointegrative Health Center in Reno, Nevada. They do all kinds of different treatments. You can check them out online at Biointegrative Health. Well, what's the web address, Doc?
Oh, it's a BIHCIRENO.com.
Okay, yeah, you should be able to find it if you just search Biointegrative Health Center.
Yes.
So, welcome, Doctor.
Thanks, Steve, for having me again. Pleasure.
Okay, so I want to kind of get into all the different treatments that you guys do at the clinic. So I want to do a series on just the different treatments. So let's start with a vitamin C drip. So I know there's different treatments that have vitamin C in it, but let's start with what we call Mega C. How many milligrams are in a Mega C vitamin drip?
Steve, you just brought up one of the more popular treatments that we have here. And variations of IV drips that we have as selections for patients, and this is one of the hotter ones. Well, it packs a wallop of vitamin C to beat a sack of oranges. Well, with this one, you don't have to peel that much, and who needs to drink a gallon of orange juice? The thing here is there are different definitions of when you use mega or high dose in the IV world, and you would usually hear that 15 to 30 grams is higher, or what we call them, they call it sometimes as already mega, but in actual real practice, generally it's supposed to be 50 grams or higher. And that's being followed by a lot of institutions, especially the cancer centers. And the basic IV vitamin drip, which is less than 50 grams, usually is more for general immune and antioxidant support. And then for the higher ones, such as the 50 grams and up, they're usually nearly more for oxidative purposes, thus creating more oxygen into the system to bring the benefits of vitamin C to the maximum.
Okay, so let's put that in perspective. You said 50 grams, that's 50,000 milligrams of vitamin C.
Yep.
So let's talk about what's in a capsule. You go get a good quality 1,000 milligrams in a capsule.
Right.
Is that a normal dose? I mean, talk about the difference between 50,000 milligrams right there into your vein compared to 1,000 milligrams orally.
Right. Steve, that is a common question that I always get from my patients, and they're always asking about oral versus IV. Well, so let's talk about oral initially. Usually, the market availability of dosing of vitamin C is around 500 to 1,000 milligrams, and orally we can only absorb 600 to almost 700 milligrams every intake. Meaning anything more than that in that one intake will be thrown away. Thus, you have expensive P. Capacity of the intestines to absorb in one intake of C is 600 to 700 milligrams per capsule that you take in. This is the reason why it has to be spread out. So if your doctor or a health provider suggests to you about taking vitamin C, you'll notice that take it 2 to 3 times a day or every 4 to 6 hours. It's not like take it one and you're done. So basically that's more of wasting your hard-earned money right there. And what do you factor in terms of the absorption issues is that the commercially made products, sometimes they have fillers and unnecessary ingredients that they don't claim. A good example for you, some market products were actually claiming that they have 1,000 milligrams of C, but on lab analysis, they only have 500 milligrams. There you go, the expose is out. And another factor is the dysfunctional gut. that lowers the dose absorbed even more. So if you have bloating, if you have IBS or leaky gut, then that 500 or 1,000, probably what, 200, 100 milligrams absorbed.
So let's say I want to come in and I want to get a high dose vitamin C. I know that's a treatment that I've done at the clinic, at your clinic, and I had to get some blood work. Is that common, or can you just come in and say, I want a high dose vitamin C?
Well, Steve, yeah, definitely a good information to put out there for everybody who wants to attempt to receive it. It's almost applicable to any ill condition. And safety, if you ask, is safe if you're being handled by an expert medical professional and those who are experienced. Meaning, yes, as we do here in the clinic, our clinic has been running for almost 30 years. So this is one of our bread and butter. And what do you need to check before receiving vitamin Omega C or high dose vitamin C? First, you have to check your heart status, for the reason that when you give high doses of vitamin C, you put it in a huge amount of fluid. And that's why heart failure, fluid retention issues due to high amounts of infusion can be a serious condition if a heart cannot handle the load. Another one is we check labs for sure. And the most important one for vitamin C or Omega C is what we call the G6pd levels. And what is that? So people are, oh, what is he talking about? So G6pd protects your red blood cells from oxidative stress. So it's protecting the lining of it so that it would not rupture. And that's why if you are lacking, so when you have actually what we call G6pd deficiency, you are not eligible because your red cells will get destroyed by high dose vitamin C. If you're lacking, there will be rupture of the red blood cells, which can lead to renal problems, liver problems, and usually this problem or genetic condition is expressed in males. Another one is we check iron levels, because if you have high iron levels, it can also oxidize vitamin C, meaning it can create more free radicals, do more harm than good. And the biggest scare of everybody is oxalate kidney stone formation when you get high dose vitamin C, thus leading to renal problems. The thing here is people who has pre-existing conditions are higher risk, but not a risk for healthy individuals. And it's usually preventable if given nutrients such as magnesium and B6 along with it. So again, very safe if your provider they know what they're doing.
Okay, so to me, that's just such a massive amount of vitamin C. So what happens when you get that much vitamin C right into your bloodstream, bypassing organs, the stomach, what happens?
Well, Steve, that is the biggest question. Will you turn into an orange? Or will you be darker than yellow? Oh no. IV, you have to remember, is the most desirable in relation to absorption. Remember, oral C can be a gastric or intestinal irritant. Up to 2,000 milligrams is your limit. And then if you reach that, diarrhea and cramping is not far away. IV forms as high as 25,000 milligrams or even 100,000 milligrams can be delivered safely by medical professionals and with the proper and assured absorption. So the concept behind this is, why do we do that? Why do you want all of that vitamin C in there? Because vitamin C breaks down into what we call peroxide molecules, leading to toxic material to all cells. But you have to remember, normal cells have a large supply of the enzyme called catalase, meaning it's their buffer to protect themselves from the peroxide molecules to convert it into water to add more hydration to your system. When you talk about infected or defective cancer cells or even infected cells, they have 10 to 100 times less what we call this catalase or blocker than healthy cells. Thus, they cannot detoxify peroxide and they die eventually.
So I'm healthy. I'm a healthy person. I'm kind of a health nut. So what happens when someone like me goes in and gets this high dose vitamin C in a healthy person? How long will I get benefit from it? Talk about that a
Well,
little.
yeah, so that's definitely a good point. That healthy individuals, of course, not everybody's healthy. Even the healthy ones have hidden infections, like for example, herpes or oral canker sores, even shingles, and even HPV, and even acute infections such as the flu, rhinovirus, and even rotavirus. So that's like the flu, and also yeah, some diarrhea for the kids usually are always related to that. And if healthy, again, vitamin C is not detrimental. It actually boosts that immune system as prevention. And vitamin C is actually good for healing, and it actually is part of the buildup of collagen. And we use this a lot for surgery, post-surgery procedures, and also people who had injuries like athletes who wants to repair their tendons and cartilages that had damages, and also healthier ones actually benefit from detox. It stimulates the liver and removes heavy metals and the excess calcium out of the system.
Wow, who would know that vitamin C does that? So how long will it last? When I get omega C, how long do I get the benefit? Is it a month? Is it 2 weeks? Is it 2 days? How long will I get a positive benefit in my body for when I do this treatment?
Right. Well, so in pharmacologic terms, Steve, the 50 to 100 grams can actually stay in your body 6 to 8 hours. So again, I always want to compare this when I explain this to patients to a hand that dropped a seed in the soil. So 6 to 8 hours is dropping of the seed, the actual procedure, meaning the laying of the ground, but the effects can still happen afterwards, after the 6 to 8 hours. This will be the next few weeks, the next months of possible repair, immune boosting, and even killing of microorganisms as the seed grows. Meaning, as the cells absorb vitamin C, they will find a need to use it and absorb it. And the cells that actually doesn't need it, for example, infected cells, they get destroyed. That's why the chain reaction effects of IV vitamin C actually has longer benefits, even found to be around 24 to 78 hours. But I want to go back to the 6 to 8 hours. These are the actual numbers when after an infusion, actual molecules of vitamin C will be found in your bloodstream, then will be excreted by your kidney.
Okay, so what types of sicknesses or ailments, health challenges do you use this treatment for? For people that are sick, or what are all the different things that this treatment can be used for?
Right. Well, Steve, there are so many conditions that we use Mega C on, and we have to remember that when we're thinking about Mega C, people always think about the safety. We always have to remember it's water soluble. It's a non-toxic vitamin and does not accumulate easy due to the easy elimination of it. So usually we frequently utilize it during detox for healthy patients, even non-healthy patients. Cancer, number one is cancer. I work in the cancer facility, and we use a lot of high doses of vitamin C there. And even infections and anti-inflammatory and antioxidative characteristics of omega C is very prominent, and it lowers down the free radicals for anti-aging therapy. And for several conditions, such as even heart conditions, autoimmune conditions, fibromyalgia, and just to give you a little history here, from way back during the 1930s to 1950s, diphtheria, tetanus, viral pneumonia, and also cancer, may it be early or late stage, actually are being used by, using high dose vitamin C to address these specific problems. And as you can see, this is actually how C will kill infections, and cancer cells usually are going to be are not going to be spared. Meaning, when people ask me about, so is my cancer cells going to be and my normal cells also going to be get killed by omega C? No, it's actually being selective. That cancer cells are the only ones that perish.
Wow. So great treatment. In the weeks to come, I want to talk about the many other treatments that you're doing at the clinic, and also there's a lot of new treatments that you guys are doing now, cutting edge new stuff that I can't wait to hear about. Not only can't wait to hear about it, I want to try them. So
Sure.
That's Dr. Nario, Biointegrative Health Center in Reno, Nevada. Check them out online. Thanks for being with us, Doctor.
Thanks, Steve. As we all know, the knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.